Today on A Nation Betrayed, we are honored to welcome Dr. Heidi Klessig, an anesthesiologist, pain management specialist, author, and nationally recognized speaker whose work is transforming the way America understands brain death and organ procurement. Dr. Klessig has devoted years to investigating the scientific, ethical, and legal foundations of the brain death concept, examining the history, the medical guidelines, and the heartbreaking real-world cases that reveal how deeply flawed and dangerous this diagnosis can be. Her powerful research is featured on respectforhumanlife.com, where she provides education and advocacy for families who are often pressured into decisions without truly informed consent. I'm going to play this video as an opener to this show that Heidi Bond wrote this song for Dr. Klessig about her work. And I think that this will give people a very big understanding of the human aspect of these stories and the brain death fallacy, which is the name of Dr. Klessig's very good book. I've read it. It's an amazing book. A must read. So I'm going to play this intro, and then we will get on with the interview.
I was young with a healer's heart, just learning how to trust my hands. I walked those halls believing medicine was built on truth and plans. But then one night I touched warm skin they'd already labeled brain dead. His chest still rose, his heart still beat, and questions flooded in my head. They said prepare the donor, but nothing felt aligned. And I whispered to myself, if he's dead, why does his body still respond to mine? That moment never left me, it rewrote everything I knew. I carried it for years until the truth finally broke through. So I wrote the brain death fallacy, because families deserve the light. And I could not stay silent while the world was told a lie disguised as a right. I followed every thread I found, the laws, the words, the history, and I learned how brain death was constructed to make procurement legally easy. Not to honor what life truly is, not to guard a fragile soul, but to soothe the conscience of a system that needed bodies to stay whole. I saw how swelling, drugs, and injury can mimic what they call the end. Yet people breathing on their own were being taken from their families and friends. So I wrote the brain death fallacy to say what others wouldn't say. Brain death is not true death, it is a legal term they redefined one day. I wrote it for the parents, for the husbands left behind, for the mothers signing papers without anyone being kind. I've seen the children who grew afterward, the women who carry life inside, the patients who woke with memory after doctors said they'd already died. I've watched the harm the apnea test can cause, a test they never explain. I've seen drugs suppress a body till no movement can remain. And I promise God that day, if I know the truth I cannot hide, I will stand between these families and the force that takes their child. I'm not here to condemn my colleagues, most were never truly taught. They trusted what the textbook said, as I once blindly thought. But courage is a quiet thing, a whisper you cannot shake. And my conscience said, Heidi, speak, even if your voice must break. So I poured it all into the pages, every fact, each painful scene, to show what's real behind the curtain and what the definitions really mean. Yes, I wrote the brain death fallacy, so no family stands alone, so no mother loses her child, because truth was doctor, a witness, a healer with a fire. And I'll keep shining light into the darkness for every soul they call expired. Because life is sacred, precious, until true death takes its stand. And I will keep on fighting with the truth held in my hand.
All right. That was a great song. That, in a nutshell, I think it just explains so much. Heidi Bond, Heidi, um, you had a recent experience with this. I mean, we know people who question whether their loved ones were truly even gone because the organ donation people were chomping at the bit. Like Ellie, who's on our board, Ellie, Ellie Hayes, her brother went through this in Kentucky. He they his diagnosis or his DNR status was actually changed by the ethics committee. He was 39 and they just changed it and called the family and said the ethics committee met. We changed his status to a DNR, and he was an organ donor, or he wasn't an organ donor, but CODA was called in. So she, they of course have been victims of this. But you had a recent experience with a young man, teenager. Uh,
Yes.
Tell people about that before we get started.
Yeah. So here locally, my son and a group of friends went line dancing. After the evening was over, Christian, one of his friends, driving home, was at a stoplight and a drunk driver hit him and he was brought into the hospital. And knowing what I know now, upon arrival, organ procurement organizations are called even before the person is diagnosed brain dead. So these organ procurement organization was called, and they start putting pressure on the family right away for donating organs. My friend, who is an infectious disease doctor at that hospital, said they're like vultures. So yeah, they pulled the plug after 5 days.
And they talked the parents into. Well, they started earlier, right? Trying to
Yes,
talk the parents in right away to
yes, they were pressured.
high pressure. They use very high pressure tactics. So, Dr. Klessig, your journey began, and I'm going to pull up your presentation in a second here, but your journey began very early on in your career, first year of residency, right? So, um, do you want to? I can pull up the presentation if it's in there, and if you want to go through it. But if you can, because I would love for you to talk about why, how this journey began with you, and then I know that in your presentation we're going to answer the questions of, are brain dead patients biologically dead, brain dead patients? Do organ donation protocols violate the dead donor rule? Why the definition of death? Why the definition of death has repeatedly been altered? I don't think a lot of people know that. Um, and how many families are misled into believing that their loved one was gone when they're not. Your presentation is going to answer a lot of those questions that people are now starting to ask, because there's a lot of attention on this issue. I mean, there hasn't been for decades, and suddenly there was that case in Kentucky that just blew everything open, and now the federal government is even looking at it. So I'm going to turn it over to you if you want to add anything, about to the introduction, and then I'll pull up your presentation to go
Thank
through it.
you. Thank you so much, Gail and Heidi, both. I had thought it would be a really good way to introduce our session with that video, but now I'm sitting here all choked up. I was like, wow, it's a heavy subject. And I think partly because of that, it's something that people tend to put off thinking about. We don't like to think about death anyway. But if we don't think about it and understand how, again, definitions of death have been intentionally changed for the sake of organ procurement. And that's something that if you're not aware of it and you sign a donor card, you become legally obligated to donate those organs. A family member, a healthcare surrogate cannot change that document. And so we need to wake up now and look at these things now, before the worst day of our life happens. And we're sitting in a ICU. We haven't eaten, we haven't slept. We're being given high pressure tactics by people who think that your loved one might be better off dead and they would like those organs very much. Thank you. So let me tell you how I came to this. I did not set out to write books or speak or have songs written about this. Certainly, I just came in for a night call one night. I showed up in the late 1980s during my anesthesiology residency program, and I reported to the operating room desk for duty. And the doctor there said, "Oh, Klessig, we're glad to see you. We're going to have you go up to ICU. There's a brain dead man up there, and we're going to have you bring him down and give him an anesthetic for the removal of his organs." And I was a little bit unsettled. I realized I must have heard a lecture about brain death somewhere along the line, but at that moment in time, I didn't have all the facts right at my fingertips. So I asked him, "Brain death, huh? Is there anything different about this case that I need to know?" And he laughed. He laughed and he rolled his eyes and he said, "Just be sure someone has declared him brain dead. You know how eager the transplant team can be." Not what I wanted to hear, Gail, not what I wanted to hear. But I went up to ICU and I found my patient, and he was a young man. He was around my own age at the time, and he had been in a motorcycle accident and had a very severe head injury. And the neurologist had evaluated him and had gone through the brain death protocol checklist and had declared him to be brain dead. So I went to look at my patient, but when I went to see him, he didn't look dead. He was laying in the ICU, and he had a good, strong heartbeat. He had a good blood pressure. He had nearly 100% oxygen saturation in his blood. He was warm. He had good skin color. He looked like every other ICU patient I had anesthetized. And in fact, he looked better than most. He wasn't on much for drips or drugs or infusions. So I went back down to the operating room and I found the supervising anesthesiologist who was going to be, proctoring me for the case. He was my instructor. And I presented the facts to him and he said, "All right, what's your anesthetic plan of care?" And it goes to show, how very brainwashed I was. I was trying to think in the way they were training me to think. And so I said, well, I'm going to give him a paralyzing agent so he doesn't move during the surgery. It's, surgeons get crabby if people are moving and it's hard for them to operate. And I'm going to give him fentanyl, which is a potent painkiller, to blunt any swings in the heart rate or blood pressure that might damage his organs. So then my attending looked at me and he said, "Okay, that sounds fine. Are you planning to give a drug to block consciousness?" I was stunned. I was confused. I asked him, "Why would I do that? Isn't he dead?" And my attending just gave me a long look over his surgical mask and said, "Why don't you give one just in case?" And he walked away. Did that make any sense? Does it make any sense? It didn't make sense. But, I'm thinking, I'm the trainee here. All these people seem to think it makes sense. So I must be missing something. So I tell you, it's to my horror, shame, and regret that I just did what I was told at that point. I took that young man with his, beating heart. And I brought him down to the operating room and I gave him the anesthetic we had discussed. And he reacted to the incisions, the bone saws, the organ removal. Just like any other patient, he required the same types and amounts of anesthetic as anyone else. And I'm quite clear in my mind that, I have participated in what is essentially a medical homicide. That man was neurologically injured, but he was in no way dead. I told this story to a pathologist friend of mine later, and she said, Heidi, when I take organs out during an autopsy in the morgue, I don't need to give any of those drugs.
Yeah.
This is what set me on my journey. I mean, honestly, as I started to review the medical literature, I was sort of hoping that I could justify my actions. But come to find out, all the evidence, all the tests, all the studies, all go the other way. These people are not dead. They are neurologically injured. And interestingly, just this past week on Tuesday, Columbia University School of Professional Studies had two experts in brain death speaking, Dr. Robert Trug and Dr. Loris Calgin. And both of those doctors agreed that brain death is a legal fiction made up for the sake of organ procurement. And the only difference between those two doctors was that Dr. Trug, he would like to be more honest with the public about that. But because we need those organs to give to other people, he would like to withdraw what's called the dead donor rule and expressly allow organ procurement to take organs from living people. Now, the dead donor rule says that organs cannot be removed from a living person, nor can removal of organs cause the death of a person, right? So this is an important safeguard. And Dr. Kelgin, whereas he would also like to be honest with the public about the fact that brain death is not death, he believes the dead donor rule is an important safeguard that reflects our society's respect for life and desire to protect it. So he would say that we need to continue to uphold the dead donor rule and protect neurologically disabled people at the end of life from having their life removed via organ procurement.
That's right. Because whether it's 5 minutes or 50 years that is robbed from somebody's life, it's still homicide. And so, yeah, that is, I mean, with the dead donor rule, I think it's safe to say that all organ removal breaks that rule unless the person is deceased. So all organ removal for the purposes of transplant. Yeah, let me, I'm going to pull up this great presentation so we can go through it. The song and that type of introduction, I think, is the thing I love about the song is that it introduces the human aspect of this. So there's the clinical aspect and the reality of what's happening on the ground. And then there is absolutely the human aspect, which people need to understand that these are families, these are human beings that have been affected for, we can't lose our virtue for any type of, even if it's for the greater good, supposedly for the greater good. So let me pull this up and
yeah, a couple of things you said I want to just emphasize a little bit. You are quite right, Gail. You cannot take organs for transplant unless the person is still alive. Tissues, on the other hand, things like skin, bone, corneas, heart valves, those can be taken from someone who's biologically completely dead, their soul is departed. But organs, things like heart, lung, livers, kidneys, to be viable, really do have to be taken from someone who is still biologically alive at the time of their procurement. Yeah. And the other thing you brought up that, again, I want to highlight right away is what I liked about what Heidi put in the song. We're not condemning people. We're wanting to educate people. And so I always am in a hurry to say, if you are a doctor or a nurse, it's it's not possible that you can personally research everything you are taught. You are forced to take a lot on authority, as I was. I was accepting what my authorities told me. But, of course, arguments based on authority or on the majority opinion are both logical fallacies. They are not a way to discern truth. So it's not your fault that you were taught this, and that's what you were expected to believe. I also tell people, if, like Christians' parents, if you gave a beloved son, daughter, brother, mother, family member to become an organ donor, it is in no way your fault that you were deceived, that you were not told these facts. You made the best decision you could with the information you had available at the time, right? And thirdly, if you have received an organ, we are glad you are here. We respect your life as well. Again, it is not your fault that you were not told that organ may have been procured in a way that might violate your conscience. But now, we need to speak the truth in love to one another. And that's why I do what I do.
Awesome. Wonderful.
So if you want to skip ahead, Gail, I'm going to start, just talking about, we need a good definition. When is someone dead? And again, death has been declared, discerned, recognized for thousands of years. You didn't need a doctor to tell you if someone was dead for most of recorded history. So death was noticed when people were at home, on the farm, on the battlefield. People mostly, if you want to keep going, Gail, a few more. There we go. Most people of most faiths or no faith at all define death as the separation of our immaterial part from our material part, right? The departure of the spirit, the soul, the life force from the material body. But, the spirit is immaterial. We don't have any device. We don't have a soulometer that we can use to see when that happens. So what we do out of precaution, we want to be very sure. We want to use the precautionary principle to be sure people have truly departed. We traditionally in time have used the loss of the body's homeostasis, right? The loss of that seamless functioning of the body as a whole, and the loss of heartbeat and the loss of breathing traditionally have been the index signs. And then the passage of time, right? We don't want to be in a hurry. We want to be sure that person has departed. There, you do hear stories once in a while of someone waking up in the morgue. So that's where our traditions of the wake, the vigil, the visitation come, to give that time to be sure the person is dead. Also, important time for grieving and for understanding that separation has occurred. But with the advent of organ procurement, all of this changed, right? The other thing that I should be in a hurry to tell you, and that's on the next slide, is that if you could still be resuscitated, you were never dead, right? And when Gail brings up the DNR, the do not resuscitate order, that becomes very important too. Nobody comes back from the dead, which would be resurrection, without divine intervention. But people are routinely resuscitated after being, in a cardiac arrest for up to 10 minutes. We can bring people back using medical techniques. Those people were never dead, even though, at Thanksgiving, people might say, my Uncle Eddie died 5 times, but the doctor kept shocking him back to life. Now, we know what you mean, but Uncle Eddie wasn't going to heaven and back, heaven and back, heaven and back. Uncle Eddie was still there and had enough life in his body that he could be resuscitated. But if you give someone a do not resuscitate order, now, while they possibly could be resuscitated, it's not going to happen. And that becomes a problem, as we will discuss going forward. So in 1968, on the next slide, because of organ procurement, Dr. Christian Barnard had just done 2 heart transplants in South Africa. And in the US, doctors were quite eager to, get on this transplant bandwagon. So 13 men associated with Harvard Medical School, 2 of whom were transplant surgeons, by the way, came up with this idea that we could redefine certain people in a severe coma as somehow being dead already. Now, interestingly, this paper has no medical or scientific references. They just had this opinion. They said in the paper, and the next image, our primary purpose is to define irreversible coma as a new criterion for death. Now, no doctor can say that something is for sure irreversible, right? We're not God. We're making an educated guess that this coma we think will be irreversible, but the many brain death survivors show that we're not absolutely perfect at that. But again, they wanted to change a definition. And this has been sort of our battle in recent years. It's the battle over the dictionary. You know, does changing a definition change the reality? Well, no, it doesn't. In fact, the 13 men on the Harvard committee never said that these people were actually dead. In fact, they called them desperately injured. And they said that redefining these desperately injured people as being dead already would free up ICU beds, and it would remove the controversy over removing organs from comatose people to put into someone else. So this was a utilitarian pronouncement. This was not a scientifically based pronouncement. They just thought it would be good for society as a whole. And on the next slide, it was very good for doctors because it does keep doctors from getting sued. So we talked earlier about the dead donor rule that says people must neither be alive when organs are removed nor killed by the process of organ removal. If you redefine these people to be dead already, now you meet the dead donor rule by sleight of hand. And this is what keeps doctors from being sued for doing this. There's only been one prospective multi-center study of brain death on the next slide. That was done way back in the early 1970s. They took people who had been declared brain dead, and interestingly, the process, the protocol for that back then was stricter than what we use today. Of 226 brains they took to autopsy, 10 were grossly normal. Only 40%, less than half, showed diffuse tissue destruction. So the investigator said it was not possible to verify that a diagnosis made before cardiac arrest, the traditional means of determining death, would correlate with a diffusely destroyed brain. So the principal investigator on the next slide said, does a fatal prognosis permit the physician to pronounce death? And this is an important point I want you to remember. This diagnosis of brain death is a prognosis. Death may possibly occur, but it's not a diagnosis. Dr. Molinari, who was one of the chief investigators of this study, wrote, it's highly doubtful that such glib euphemisms as he's practically dead, he can't survive, he has no chance of recovery anyway, will ever be acceptable legally or morally as a pronouncement death has occurred. But you know what? That's exactly what happened. That's exactly what we did accept. These people have a fatal prognosis. They may possibly die, but they are not dead already. So in 1981, a president's commission was arranged, and they were told, the testimony that they were given was that once you had severe neurological injury, biological death would very quickly occur. Again, the argument was still based on a prognosis of death, not a diagnosis. Not even all of the President's Commission agreed on this. And the next slide, Harvard professor of philosophy, Daniel Wickler, who wrote the chapter for the President's Commission, Understanding the Meaning of Death, said later that he fudged. He made it up. He said, I was put in a tight spot and I fudged. I knew there was an air of bad faith about it. I made it seem like there are a lot of profound unknowns and went in the direction of fuzziness so that no one could say, hey, your philosopher says this is nonsense. That's what I thought, but you'd never know it from what I wrote. But despite Dr. Wickler's doubts, this is what got passed into law. The Uniform Law Commission wrote a model law called the Uniform Determination of Death Act, and this has been accepted in some form by the majority of states. In the U.S. right now, there are two ways that you can be legally dead. One is the traditional cardiopulmonary definition, the irreversible cessation of circulatory and respiratory function. The second is the new neurologic definition, the irreversible cessation of all functions of the entire brain, including the brainstem, is dead. But again, this is not scientifically the case. So in 1998, on the next slide, Dr. Schumann, who's a pediatric neurologist from UCLA, he's retired now, but he published from the literature that he reviewed 175 cases of supposedly brain dead people who lived after their death was declared under the UDDA. One of these lived for more than 20 years, right? So what the President's Commission had been told, that death would very quickly ensue, turns out not to be the case, because these people simply are not biologically dead. They are neurologically injured. This was taken so seriously, this finding of Dr. Schumann's, that a second presidential council was convened in 2008. And they said that Dr. Schumann's work left two options. Either, number one, we have to abandon this neurological criteria for determining death, or we have to develop a new rationale for explaining why neurological criteria should equal death. And we all know which one they chose, right? They came up with a new rationale on the next one based on a questionable philosophy. They coined a new term. They said these people have total brain failure. And if you have total brain failure, you're no longer able to do what they call the fundamental vital work of being a living organism, being able to preserve yourself in your interactions with the environment. Well, this is an ability-based definition. This allows disabled people to be categorized as dead and their human rights removed. On the next one, this new idea from the 2008 President's Council does not reflect scientific facts. First of all, total brain failure is inaccurate. People who have been diagnosed with brain death certainly still do have brain functions. 20% of these people that are tested, and again, not many are tested because EEG is no longer required for a brain death diagnosis. But if you do EEG on people diagnosed brain dead, it's been shown that 20% still have brain waves. Okay, that is function of the brain. Over half, over 50%, have a part of the brain called the hypothalamus that continues to function. And the brain death guidelines used by doctors today expressly say that you may declare brain death in the presence of ongoing hypothalamic function. Now, I'm sure most of you have never thought about your hypothalamus, but here's what it does for you. It's an important part of your brain. It maintains your body temperature. It maintains your blood pressure by telling your body how much salt and water to withhold or excrete. It's important for sex drive. It's important for pain detection, and it's important for awareness. Now, that's an important list of functions for the brain, but according to our current brain death guidelines, you can be declared brain dead while all those things are still functional. And second, these people who have been declared brain dead, they absorb nutrition, they excrete waste, they heal their wounds, they clot. If you make an incision on them, they clot and heal the wound. They fight off infections. And I can tell you from personal experience, they have a very intact stress response to the incision to remove their organs. And these are all the work of self-preservation, negating the 2008 President's Council's new definition. And again, on this commission, there were dissenting views. Dr. Edmund Pellegrino, after whom the Pellegrino Center for Bioethics at Georgetown University Medical School is named, he wrote a dissenting opinion. He said, the only indisputable signs of death are those we have known since antiquity: loss of sentience, heartbeat, breathing, mottling and coldness of skin, muscular rigidity, and eventual putrefaction, right? He went on to say, I've chosen to give priority to the welfare of the patient before he or she becomes a donor, on the grounds that harm must not be done even if good comes from it. And this is the important part. No person should be sacrificed as a means for the good of another. This is a moral precept that recognizes the intrinsic worth of every human being. And I'm going to give you an example of how the system goes wrong. In 2007, a young man named Zach Dunlap, if you want to show his picture on the next slide, Gail, he was involved in one more head. He was, I've got a different slide deck than you, so keep going. I think we'll come to Zach Dunlap. I'm going to go with your slide deck because I'm looking at the wrong one. Go back to where we were. So let me tell you again, the law under the UDDA is what we're going to go through now and show how this doesn't actually apply. So keep going, Gail.
Okay.
Now, we talked about the AAN brain death guideline, right? And none of them have ever been actually testing for what the law says. The law says we have to have the irreversible cessation of all functions of the entire brain. But the brain death guideline only checks 3 things. They check for coma, right? They check for loss of a few brainstem reflexes and no breathing with the apnea test. So we'll go to the next one. So the AAN brain death guideline that people use today, this is what it looks like. It's a busy slide, so let me kind of go through it kind of bit by bit with you. The first is that we cannot have responsiveness, right? So the problem being, no doctor can tell you if you have a loss of inner awareness. Our inner awareness is a first person experience, right? No one can tell what I'm thinking inside, what you're thinking inside. All we can tell is what you give us on response. So a brain dead, supposedly person could be completely inwardly aware, but just unable to respond, so it's not the same thing. At this point, I am going to quick talk about Zach Dunlap because this became important in his case. He was a young man who was in an ATV accident. He had a terrible head injury. He had brain matter coming out of his ear canal. He was brought into the hospital and he was declared brain dead. But Zach told doctors later, I could hear every word. I could just lay there in the bed, unable to move, hearing doctors tell my parents he's brain dead, he's passing away. And there was nothing I could do, he said. I couldn't move, I couldn't scream, I couldn't do anything, just get extremely angry. You know, the only reason Zach Dunlap was saved from becoming an organ donor is that his cousin, who was a nurse from a different facility, similar to your husband, Gail, a nurse from a different facility who knew this wasn't making sense, didn't believe Zach was dead. And so he went in and he scraped Zach's foot with the bottom of his closed penknife, and Zach withdrew his foot. So Zach's cousin called and said, look, come over, my cousin's moving. And the nurse actually said, if you watch the video that I have on our website, the nurse said, well, they tell us in brain death school that the patients can be moving, but they're still dead. Excuse me. So Zach's cousin then gave a painful stimulus to his nail bed, and Zach pretty much took a swing at him. And the nurse said, oh, wait, that movement counts. That movement is across the midline. And so Zach was saved from becoming an organ donor. I mean, he was just moments away. The team was landing with the helicopter to procure his organs when his cousin got the whole thing called off. But, you know, as an anesthesiologist, this really troubles me because unlike what I was told, you know, many anesthesiologists do not give a consciousness blocking agent during organ procurement surgery. So if Zach had gone to the operating room at that point with one of those anesthesiologists, very likely he could have been given a paralyzing drug and nothing to block his consciousness. Can you imagine the horror of being there, awake, aware, unable to move while you're being dissected to death? It's unspeakable. The other thing, if you want to go back to the slide just previous to that, Gail, the guideline says, again, you cannot have a motor response to a painful stimulus. But you see from Zach Dunlap's case, certain movements are disallowed and others are. And in fact, the guideline says it can be difficult to tell if, you know, when your patient is moving, which movements count and which do not. And so the guideline actually says if you're not sure if your moving patient is dead or alive, you should ask a colleague, ask a friend, right? This is totally subjective. The third column shows the entire neurologic exam, right? The law says all functions of the entire brain must have ceased, but in actual fact, they only check about 5 brainstem reflexes, which is by no stretch of the imagination all functions of the entire brain. And the last column talks about the apnea test. And the apnea test is where they take you off your ventilator and see if you breathe on your own. But the guideline says straight out that this test is arbitrary because they don't have any scientific data to know in a brain injured patient exactly how high your carbon dioxide needs to rise to make you start breathing on your own. So it's, again, arbitrary. We're defining life and death based on a test the American Academy of Neurology says is arbitrary. This is absolutely wrong. If you want to go to the next slide, I like this picture of the little guy, the little egghead guy. The problem with the apnea test is you're doing something to a patient not known to be brain dead yet that will certainly exacerbate a brain injury. When you remove someone from the ventilator, it will cause your carbon dioxide to rise, and that will give you swings in your heart rate, swings in your blood pressure. It will certainly cause more pressure and swelling inside the skull and can damage the brain more. This is actually an unethical test. There are neurologists who refuse to do this part of the brain death exam because it can make a brain injury worse in someone who is not known to be brain dead. All right, go ahead. Where are we next? The other interesting thing is that the American Academy of Neurology brain death guidelines, they do not require ancillary testing except in cases of doubt. People often ask me, well, what about a brain blood flow study? Certainly, if you would give someone a brain blood flow scan, then you'd know if they were brain dead or not. Zach Dunlap had what was called a no-flow brain blood flow scan, yet he could hear every word. I mean, these tests are not sensitive and specific enough. And the AAN knows this. They wrote in their guideline, all ancillary tests have shortcomings. None are 100% sensitive or specific for a diagnosis of brain death. All right, go on. And we'll go through Zach there. Keep going. We've spoken about him. The other case that we want to talk about is Jahai McMath. Now, she was a little girl, 13-year-old girl who had sleep apnea and had a tonsillectomy and palate repair, but it went sadly very wrong. She had postoperative bleeding and had a cardiac arrest after her procedure. And she was 3 days later declared brain dead, and her parents were offered the chance to make her an organ donor. Now, Jahai McMath is an important case because she is so well documented because her parents refused to believe that Jahai was dead. They saw their little girl. She was warm. She was breathing. She was moving at times. They were Christians. They believed that her, God-given spirit was still in her body. So they contested this. So Jahai McMath met and exceeded the American Academy of Neurology brain death guideline. She had 3 doctors declare her to be brain dead. She failed to breathe on 3 apnea tests. She had 4 flatline EEG studies. And she had a no-flow cerebral perfusion scan. But thankfully, Dr. Paul Byrne, who's been a long-term advocate for people victimized by a brain death diagnosis, was able to help Jahai's parents get her transferred to New Jersey. New Jersey is the only U.S. state that has a religious exemption to a brain death diagnosis. So if on religious grounds you do not agree with the idea of brain death, you will be given continuing care. And that's what happened to Jahai. Jahai, because she was able to receive more care, actually began to thrive and improve. A few months after she was declared dead, she went through puberty and she got her period. Now, how many corpses of your experience begin to menstruate? I mean, this is absolutely ridiculous. She also began to respond to her mother's voice. Her mother noticed when she would speak to her daughter's heart rate would calm down and decrease. And then she began to respond to commands. This little girl, this little teenager, would correctly raise the proper digit if you asked her, Jahai, which is the FU finger? Okay, this little girl was in no way dead. So Jahai proves that someone correctly, according to protocol, diagnosed brain dead can recover and improve. And she regained brain waves on her EEG. They did MRIs, and interestingly, her upper parts of her brain were very well preserved. It was just the brain stem that showed destruction, and that's all that is tested during the brain death exam. So this little girl lived. She's the only person who has 2 death certificates 5 years apart in 2 different states. She lived 5 years and ended up dying of liver failure in New Jersey. You can go to the next one. So there's a very reasonable explanation. How could Jahai McMath, how could Zach Dunlap and others, how could they be diagnosed brain dead and yet recover? Dr. Cicero Coimbra, who's a Brazilian neurologist, described this back in 1999. It has a long-term global ischemic penumbra, which we usually call GIP. It's sort of like a power outage of the brain, if you want to go to the next one. So during periods of low blood flow, right, your brain, like any other organ, shuts down its functions to reduce its metabolic requirements. And at about a 50% reduction in blood flow, the EEG becomes flatline and the brain becomes unresponsive to testing. But if you go to the next one, tissue necrosis, actual destruction of tissue, doesn't begin until the brain blood flow is reduced below 20% of normal over several hours. So between 20% and 50%, there's not enough flow to support function, but there is enough flow to maintain tissue viability, which means it was continued efforts to decrease brain swelling and improve brain blood flow, recovery and healing are possible to occur. So again, if you want to go to the next one, GIP will perfectly mimic brain death because the brain isn't responding, but it is potentially reversible if you treat it. I tell people this is like a power outage in your home. The lights go out, there's nothing working, but the wiring isn't destroyed. If with continued efforts to get that flow going again, the lights will come back on, in your home and for a certain proportion of these patients as well. So we should continue to try to treat these people. We shouldn't be trying to herding them off to become organ donors when there is still a potential for recovery. Will they all recover? Of course not. Some are going to be too injured, but a proportion will. And again, when I'm in the hospital, with Gail's experience, with you in the hospital, we want people working to protect and preserve our lives. We don't want people looking at us as, better off dead, a source of potential organs for other people. All right, go to what next one you have there. So Dr. Alan Schumann has talked about this for quite a bit, but I'm going to go on to the next one because we have a lot to go through yet. Eden Halou is an important case. So in 2015, this young woman went in for a routine appendectomy and never woke up. Her father was told it was a medical mystery why she didn't wake up, as she had suffered a brain injury somehow during that procedure. She was declared brain dead, but her father, again, looking at his daughter, did not think she was dead. She was warm. She was moving at times. She was maintaining her blood pressure, and he contested this all the way to the Nevada Supreme Court, who ruled that it was not at all clear that the American Academy of Neurology brain death guideline actually adheres to the law under the UDDA. Unfortunately, Aiden did pass away. Her heart stopped beating before this could go much further, but we do have that judicial opinion. So go on. If you want to go to the next slide, Gail. Anyway, so if you go on to the next slide, then what you'll see is that because the American Academy of Neurology knew that there was a real legal challenge here, they actually petitioned the Uniform Law Commission and tried to get them to change the law under the UDDA. So for 3 years, between 2020 and 2023, I was an observer to the Uniform Law Commission, and they talked about changing the Uniform Determination of Death Act to expand and broaden the definition of death. But they were not able to come to any agreement because it became obvious as they took testimony, these people are not biologically dead. So in September of 2023, the Uniform Law Commission actually tabled their work on this. But just 3 weeks later, the American Academy of Neurology released their new brain death guideline, essentially using the proposals refused by the Uniform Law Commission, the things we mentioned earlier. The new guideline explicitly allows people with ongoing partial brain function to be declared dead. Did they have new tests, facts, or studies for this? Well, no. If you look at the methods section of their guideline, they say because of the lack of high quality evidence on the subject, a novel evidence-informed formal consensus process was used. Basically, they made this guideline not on the basis of scientific facts, but on 3 rounds of anonymous voting. Voting among people who had actually been screened so as to exclude those people who might disagree. So again, this is not science. This is an echo chamber of experts who are making these guidelines. The National Catholic Bioethics Center says the new guideline is a decisive breakdown in the public consensus on death and organ donation. So what is driving this? Yeah. So I'm way up to, I think, slide, 39, Gail, if you want to, somewhere around there. I know you and I are using a slightly different slide deck, but we're doing fine here. So Dr. Elko Vidix, one more. Do we go a couple more there? You're doing great. Another one. Keep going. There we go. Just
This one.
Stick there for now. Dr. Elko Vidix, who is a neurocritical care specialist at Mayo Clinic, actually stated at a Vatican conference in 2006, he said the diagnosis of brain death is driven by whether there is a transplantation program or whether there are transplantation surgeons. I do not think brain death examination now in practice would have much, if any, meaning if it were not for the sake of transplantation. So again, brain death is a legal fiction. The emperor brain death has no close, and people need to be aware of this and not be afraid to speak up and challenge it. Now, Heidi, you saw me speak on Scott Schar's program, and up until that program, I really generally have tried not to bring up the dollars and cents, because I think most people in organ transplant are driven by zeal more than desire for monetary gain. But after that program, in which his other guest had her mother-in-law taken to become an organ donor, Christy, her name was, she felt really betrayed when she found out how much money her mother-in-law's organs were worth in billable charges, and that was a big, important part of the conversation for her. So in honor of her and others like her, I do bring up now that the body you give away for free is worth millions of dollars. The Milliman Actuarial Company in 2025 came out with the billable charges, and you don't have this slide, Gail, because it's new, but I'll just tell you, if you give a body with just not even counting the tissues, if you give someone that has a heart, intestines, kidney, liver, lung, and pancreas, just those organs alone are worth up to and over $8 million in billable charges. The organ transplant industry, based on Milliman's figures, is a over $60 billion a year industry in the U.S. And they do say follow the money. So again, whereas I'm not impugning anyone's motives, I don't say that every person involved in organ procurement is in it for the money. It's too much money to simply discount and not talk about. So I am talking about that now. I'm going to move along now. If you go on, do we get to donation after circulatory? Yeah, keep going a little bit. I'm going to go on to donation after circulatory death. So if you want to skip ahead a little bit now. Donation after circulatory death is a way of procuring organs that came up in the early 1990s, and it was in response to our constant need for more organs for transplantation. These patients are not brain dead, but they're either not expected to survive or they've decided their quality of life is unacceptable. So their death is planned to occur at a specific time and place so that organs can be harvested. These people are made do not resuscitate, as we talked about earlier, because they could be resuscitated, but a decision has been made not to resuscitate them. So technically, according to the law, they don't meet the standards. Stay right there on that slide, Gail. They don't meet the standard of the irreversible cessation of circulatory and respiratory functions according to the law. The patients are taken, do not resuscitate. They're taken to the operating room. Medical support is withdrawn. The patient is monitored until their pulse stops. And after 2 to 5 minutes of pulselessness, depending on where you live, right? In my state of Wisconsin, it's 2 minutes of a wait. In other states, it's 5 minutes. So you're basically dead or alive based on your geography, not on any scientific facts. Once that waiting period is over, then they begin to take your organs. But going ahead on your next slide, Gail, the problem with this, as we mentioned earlier, is that everyone knows people are routinely resuscitated after just 2 to 5 minutes of pulselessness. And again, if you could still be resuscitated, you were never dead. Dr. Ari Jaffe has done a literature survey, and he's found people who up to 10 minutes after the loss of circulation, self-resuscitated without any medical help whatsoever and made a full recovery. So we know even 10 minutes is not long enough. Go on to the next one there, Gail. Because of these questions, donation after circulatory death is banned in many European countries. You see them there. Germany won't even accept organs from the Eurotransplant procurement organization in case some of them may have been procured using this technique. Next one. And there was a case here in our neighboring state of Illinois, a young Down syndrome woman. She'd had a aneurysm rupture in her brain, but she was not brain dead. Her parents were given the opportunity to make her an organ donor, and so she was taken to the operating room with the DCD protocol. And I think there's a little more summary on the next one. She had her support withdrawn, after the waiting period. They went in to get her kidneys, but when they cut down into her abdomen to get her kidneys, they noticed that she had pulses in her aorta and renal arteries, and she began to gasp for breath. So the procedure was called off. Sadly, she then went on to pass away. The county coroner, in evaluating this case, had to call it a homicide. Those doctors actually were the instrumental cause of her death. This was just brought up in another sad case in a New York Times article in July, the case of Misty Hawkins. Misty was a young woman who choked on eating a sandwich at home and was brought to the hospital with a severe low oxygen brain injury. She also did not meet criteria for brain death, but her parents were told she would not recover, and they were offered the opportunity to withdraw her care in a way that would allow Misty's organs to be donated. And, Misty's parents didn't want Misty to suffer. They were hoping something good could come out of their tragedy, so they gave their permission. So Misty was taken to the operating room. She had her care withdrawn. It took her 103 minutes to become pulseless. They gave her a 5-minute no-touch period, and then they started in for her organs. But when the surgeons sawed through Misty's breastbone, they found her heart had started beating again, and she was breathing once more. So the surgeons waved off. It's not clear if they gave her any anesthetic at this point. Another doctor stitched her up, and 13 minutes later, her heart stopped again. Now, that's bad enough, but what really hurts my heart on this case is that her parents were never told. Her mother received a phone call from the organ procurement people saying, we're sorry, it just didn't work out for Misty to become an organ donor. It wasn't until a year later when the New York Times reporter approached the family for comment that they learned what had happened to their daughter. As a mother, I can't even imagine learning this from a reporter a year later and the betrayal that she must feel, right? So again, DCD donors are not dead. If you want to go ahead on the slides, there's a variation of DCD called NRP. And if you thought it was dark already, I'm sorry to tell you, it gets worse. The NRP is a special way of doing this in which they want to be sure that the heart is in good shape for donation. So they do the DCD protocol, but then they want to sort of reoxygenate the heart to keep it in good condition to put into someone else. So what they do is they clamp off the circulation to the brain, and then they perform a complete resuscitation on the organs such that the heart starts beating again in the person's own chest. Now, how dead are you if the doctors can get your heart to start beating again in your own chest? Well, you wouldn't be dead at all, except now they've made you brain dead on purpose. So now you meet the legal criteria under the neurologic section of the UDDA. This is playing, again, fast and loose with the definitions of death. Go ahead on the next slide. At the University of Nebraska, they have a protocol for this, and they come right out and say, you know, we have to ligate the blood vessels that supply blood to the brain so that you don't wake up. And then at the very bottom, if you go to the next slide, once blood flow to the heart is reestablished, the heart will start beating again. Keep going, Gail. And one more. This is a picture of it that I took from a perfusion company's advertisement. There's that scissors clamp at the top that you might be able to see where they're clamping off the circulation to the head. Go ahead. So again, this is playing fast and loose with the definitions of death. First, you are declared dead according to the irreversible, supposedly, cessation of circulatory and respiratory functions. But because they are going to restart those functions, they clamp off circulation to your brain. So now you are in mid-procedure, now being declared dead according to the irreversible cessation of all functions of the entire brain, so that when they restart your heart, now they're legally covered, right? This is absolutely wrong. If you want to go ahead, the American College of Physicians recommended way back in 2021 that this practice be paused. They say the burden of proof regarding the ethical and legal propriety of this practice has not been met. But of course, no pause has actually occurred. Go ahead there, Gail. You can go ahead again. So in summary and conclusions, right, heart beating or non-heart beating organ procurement from these patients with impaired consciousness, according to these doctors who wrote this in a medical journal years ago, is de facto a concealed practice of physician-assisted death, and therefore violates both criminal law and the central tenet of medicine not to harm patients. So again, how can people call a person at the beginning of life? If you look at this, we're a lot of us very pro-life people. We would protect the unborn child before the unborn child even has a brain yet. But we will now, at the other end of life, deny humanity to someone whose brain simply isn't working very well. You know, this makes no sense. Go ahead. Again, brain death, it's important to remember, is a prognosis of death, not death itself. And harvesting organs from brain dead donors is an act of homicide against these vulnerable, neurologically disabled people. And again, going on, human life continues as long as the body-soul unity continues, even if you need technology. I mean, a lot of us need technology, right? Who knows someone on insulin? Who knows someone with a pacemaker? Who knows someone who takes renal dialysis? I mean, we're glad for these medical interventions to preserve our life. And so just because someone is needing these things, it doesn't mean that we're dead. And again, the Jahymic math met and exceeded all the requirements of the brain death protocols, and has been shown that these protocols are unable to predict irreversibility. True death is an irreversible state. Brain death has been proven to be reversible and therefore is not true death. The DCD and NRP donors, they're harvested within a possible resuscitation time frame. And again, if you could be resuscitated, you were never dead. And what on this next one, this really bothers me. The public is being denied truly informed consent when they sign a donor card. When you go to the DMV, you meet a person with no medical training. They give you no discussion of risk benefit rationale. They just say, do you want to be an organ donor? And really all you get are slogans, propaganda, if you will, give the gift of life. And people think, well, they sort of expect that this means they'll be dead in the same way, a dead pet cat or dog is dead. They're not told that these people still have beating hearts, could still be resuscitated, that people have survived these new definitions of death. They're being deceived, and I think that's very wrong.
And we get our license at 16. A
Right?
lot of people, right? So you've got these teenagers making these decisions without informed consent. That
And it's
this
absolutely
has always bothered me. This should have been the biggest red flag ever, but
well, in Texas, where you live, and in Wisconsin, where I live, they've put it on our hunting and fishing licenses.
yes.
What on earth? But, an elderly, gentleman that I know, his wife actually caught this. He went to get his fishing license, and like we all used to have to do, he signed it, right? He didn't really look at it. He just signed the bottom where it said, sign your name. Well, then he looks down, and you know what? It wasn't that he signed his hunting and fishing license. He just signed to be an organ donor. What kind of informed consent is that? That's crazy.
Yeah. Wow.
So you can go on. I think we're about to the end. Now, this is interesting, and this is Dr. True that I mentioned earlier that was speaking at Columbia University. He and Dr. Franklin Miller wrote this book, I believe, in 2011. I've got a copy of it, right here. This is their book, and they admit in the book, brain dead donors remain alive, and donors declared dead according to circulatory respiratory criteria are not known to be dead because they could still be potentially resuscitated at the time their organs are procured. Again, being a little more honest with the public. Go to the next one. This is Professor Thaddeus Pope. He's an expert on these things. He gave this talk at Tulane School of Medicine a couple of years ago. Dead donor rule violations are rampant. And his examples are exactly what we've talked about today, brain death, DCD, and NRP. And the third one there is our friend, Dr. Peter Singer. He's a utilitarian philosopher. He says, I argue the evidence now clearly shows that brain death is not equivalent to the death of the human organism. Now these three examples, they want to be more honest, but at the same time, these people's ethics are maybe different than most people's. As I mentioned earlier, Dr. True, Thaddeus Pope, Dr. Singer, all of these would like to withdraw the dead donor rule and make it expressly legal. I don't know that they can actually make it moral, but they would like to what they call change medical ethics at the end of life to expressly allow people who are not dead to be pushed into becoming organ donors.
I mean, that's like saying since homicide is against the law, let's get rid of all laws banning homicide.
Yeah.
I mean, it's crazy.
Yes. And again, the facts are coming out. There's 2 U.S. House committees now investigating both the Energy and Commerce Committee and the House Ways and Means Committee are now investigating this. Robert F. Kennedy Jr. and HHS are investigating this. We need to let people know these facts. The idea of GIP has been known about since 1999. I mean, these people are not biologically dead. They have the potential to improve with continued care. And again, it's not that we have anything against people with organ failure, but we would like them to have ethical ways to treat their problem. And so, why are we continuing to pour money into these unethical systems? We should support ethical treatments for organ failure.
You can't do evil to do good. So
that's exactly right. All right. So again, until these problems are solved, I recommend that nobody be a registered organ donor. And you've got a nice copy of that card. And this is from our friends at the HALO organization.
Yeah.
Heidi, they actually put your song and Christian's story up on their email alert this week. They were so moved by what you did. Thank you very much for that.
Praise God. Now tell me, does this form need to be notarized? So
what I would do, this one is signed. It is not notarized. It's witnessed. But you need in our website, we also use HALO's healthcare power of attorney document, and that you do get notarized. Important to tell your family and friends, your wishes too, because they're the ones that are going to be targeted by people who have an agenda to get organs. And so be sure that they know about this as well. Have it put in your electronic medical record when you go in. My daughter was just having a minor procedure, and she asked the nurse to put this in her electronic medical record. And the nurse says, boy, I don't think I've ever had anyone ask that before, but sure, we can do that. And so you have it registered that way. If your wallet card falls out of your wallet in a car accident or whatever, that will be with your someone will know about it. And again, when you have your healthcare power of attorney document, do take that in, and they'll scan that into the medical system as well to just register that you don't want to be a donor, because most people aren't aware of this. They think, well, if I never signed a donor card ever, I'm probably safe. In actual fact, legally, that is not true. The Uniform Anatomical Gift Act was a law that was revised in 2006. And that law says that if you come into a hospital and you're incapacitated, your family or healthcare surrogate can't be found, in a timely manner, the hospital administrator is empowered to donate your body or organs on your behalf if you do not have a specific refusal. So not only, should you get off donor lists, I do recommend, if you don't want to be a donor, you should have a documented specific refusal. This happened just recently, a couple of years ago in New York City. A vulnerable adult, an elderly grandmother, wandered away from home. Her family said she had information in her pocket that would have tied her to someone who was connected to her, but she got hit by a subway train. She was taken to the hospital, pronounced brain dead. They said they couldn't find her family in a timely fashion, and they harvested her organs and ended her life. And now the family is suing about that. But that's what the Uniform Anatomical Gift Act allows.
Okay. We'll make sure we get this website on our website. Mm-hmm. So that people can find it in our resources.
Yeah. And again, just to close, Dr. Schumann has done so much work in this area. He's done many, many, many scientific papers over time. He has said, just as cigarette ads are required to contain a footnote warning of health risks, ads promoting organ donation should contain a footnote along these lines. Here it comes. Go ahead, Gail. Warning, it remains controversial whether you will actually be dead at the time of the removal of your organs. So again, that's why I have the website. I have the books. I have a series of short videos on YouTube to explain to people in 5 to 10 minute fashion, some of these topics. If you want to just get a quick overview, please take a look at it now, before you're in crisis. Think about these things. Tell your family and friends what you think about them, and share the word, because again, we need to speak the truth to one another in love.
Yeah, I agree. And you're very good at explaining this in a way everybody can understand it, right? So, because we're not doctors, most of us are not medical professionals. We don't even know what half of the words mean sometimes in terms of, when medical professionals throw out the jargon, right? So but you're very good at, if I was going to tell somebody to explain organ harvesting and the fallacy of brain death, like they were talking to their 5-year-old, you're great at it. So that's good.
Yeah, thank you so much. It's important, for people to know if they did become a donor, right, through the DMV, to go in there and, right, state that you don't want to be registered as a organ donor anymore.
Yeah, on our website, if you scroll down the home page, we do have a button saying, how do I get off the donor list? And if you click that, you'll see all this information and ways to do that in the websites you need to contact.
That's about the most common question we get, right? Mm-hmm. How do I get myself off and make sure I'm off? It's not just calling the DMV. It's not just taking it off your license. You have to make sure that you're.
Yeah, there's a national registry, and you can go through that. I'm told that they now do give confirmation when you withdrew. When I went on just because people are always asking me. I wanted to know how the system works. I wasn't an organ donor, but it was sort of like the hotel California when I did. You can check out anytime you want, but you can never leave. So I had to put my name in to see if am I on the list. And as soon as I put my name in, I got an automatic email saying, "Congratulations, thanks for becoming an organ donor."
Oh no.
No. And so then I withdrew, but they didn't send me any confirmation of my withdrawal. So I actually have an email under that button. Also, if you don't get confirmation, you can email directly. And they were kind enough to send me a screenshot saying, yes, you are withdrawn. So you can get that confirmation now.
Because people are withdrawing in droves, and that's a good thing. And part of that is because of now this the controversies and why they're investigating. And so I don't know if you want to go into some of that.
If you have time, I don't know how much.
Yeah, we'll take the time because
this is important. So this is the new thing. So this is T.J. Hoover III, years after his brain death diagnosis, dancing at his sister's wedding. So you can see the story ends happy. But at the time, T.J. Hoover was declared brain dead, and he onto the way to the operating room, his family was sort of like, well, look, he's crying and he was moving around, but the family was told, oh, these are just reflexes, right? But whistleblowers claimed that two doctors, because of these responses on TJ's part, refused to remove his organs, yet Kentucky organ donor affiliates ordered their staff to find another doctor to perform the surgery. Right now, thankfully, no one else could be found, and TJ continued to wake up, improve, was able to go home and live with his sister there. But the Organ Procurement and Transplantation Network was asked to look into this, and they looked at it and they closed the case. Nothing to see here, move along, right? But that wasn't good enough. And so in September of 2024, this case was brought before a U.S. House subcommittee investigating organ procurement. If you saw the press release, right, from HHS, systemic disregard for sanctity of life in the organ transplant system. Robert F. Kennedy Jr. said, our findings show that hospitals allowed the organ procurement process to begin when patients showed sign of life, like T.J. Hoover, and this is horrifying. In their examination by the Health Resources and Services Administration, they looked at 351 cases where donation was authorized but not completed. And this was the breakdown. 103 cases showed concerning features. 73 patients had neurological signs incompatible with organ donation. And 28 patients may not have been deceased at the time the procedure actually started, right? Organ procurement was initiated. Now that is horrifying. That's everybody's nightmare.
Yeah.
Yeah.
Wow. That is absolutely a nightmare.
Yeah, and so this is the case I had talked about earlier in the New York Times, talked about Misty Hawkins. That's a picture of her bedroom. Her parents continue to sort of maintain her bedroom in memory of her. She was the young woman who had a beating heart when they saw her breastbone open and didn't tell her family.
Yeah.
Incredible.
Mm-hmm. It's just horrific. It's criminal.
Yeah, so we went through that part. So this New York Times article detailed several cases, not just Misty Hawkins. Danielle Gallegos was another young woman who, her family was like, look, she's showing signs of life, and organ procurement like poo-pooed it. Oh, don't worry about that. She's dead. Danielle Gallegos made a full recovery. There's been many more than just the ones that have made highlights.
Many more.
So this is Dr. or Ms. Kat Kamek. She was the representative from Florida that was testifying in the Energy and Commerce Subcommittee. She had very harsh words for the doctor who was running Organ Procurement and Transplantation Network during that hearing. He was saying, well, I found out about it, through the news media, just like everybody else. And she's like, wait a minute, this is your job. This all happened, TJ Hoover and all this is happening on your watch. She really put the fire to him.
Yeah, she's a fireball.
She is. This came out like a week, I think, after the New York Times article talking about these circulatory death donors who were not dead. These are three doctors, Doctors Jauhar, Patel, and Smith. They work in a transplant center in Northwell Health in New York. They wrote an op-ed saying, donor organs are too rare, and how are we going to solve this? Well, we need a new definition of death. Everything old is new again. This is the 1968 Committee on Steroids. Let's just redefine death down further so we can have more organs. They said we need to figure out how to obtain more healthy organs from donors. The best solution, we believe, is legal. We need to broaden the definition of death.
That should frighten every person in America and beyond.
Absolutely right. I mean, this is just taking disabled people to become organ donors.
Yeah.
Yeah. If you go ahead, another one, I hope you have the slide I'm going to show next. Go one more here. Oh, I don't have that one. I have a slide where if you keep going, I might have it in your slide deck. Let me see one more. Keep going. And another. There it is. This is my favorite slide of all. Here I have the new op-ed from New York Times juxtaposed with the 1968 Journal of the American Medical Association article that started it all. Do you see a parallel here?
Absolutely.
Donor organs are too rare. We need a new definition of death. And here we have a definition of irreversible coma. And interestingly, the authors of the op-ed were so brazen. They actually brought this up in their op-ed. They said their idea is not new, and they referred readers to the 1968 redefinition of death that started it all. I thought that was pretty brazen. I mean, it just shows that their respect for life is lacking.
Yeah. We talked about this on several X spaces when this came out, because the implications on, I mean, just the 1.6 million people that were killed by the protocols, and we document those stories. There's so much overlap. And this was horrifying that they would consider further redefining what it meant to be dead and leaving it up to some subjective, I mean, it already is subjective, but the whole comatose, who defines what's hopelessly comatose? I mean, in Texas, I don't know how it is in other states, but in Texas, we had something called the 10-day rule, where doctors could determine after 10 days you were dead if you were on life support. And Texas Right to Life fought many of those cases. And there was a toddler that was a big case here a few years ago, and the parents won the right to transfer their daughter and keep her alive beyond 10 days. And she recovered. She's disabled, but she recovered. And it took a year or so of therapy. But then the legislators, they have changed that to the 21-day rule, which we're still trying to get it to be, hey, how about we let God decide, right? So this is horrifying, because this is exactly what was happening in Texas. Doctors would say, "Oh, the person is unsalvageable." They use that word all the time, unsalvageable, and we're we see that in medical records.
Again, it's a prognosis. They're making a prognosis. If you're on life support, you're alive, right?
Yeah.
I mean, I ask doctors and medical students, think of your gross anatomy cadaver, right? There it is, cold, gray, stiff. Would putting that cadaver on a ventilator make it look alive? It's ridiculous. Of course,
Right.
Of course it would not. I mean, you cannot put technology onto a corpse and expect any change. The reason that people on life support look alive is because they're still alive. I mean, their prognosis may be death. And again, there's nothing wrong. There's nothing ethically wrong with withdrawing medical care at the end of life and letting, grandma or grandpa go to heaven. I mean, if it's the end of life and you're going to let the disease process take its course, that's perfectly fine. You do not need, however, a brain death diagnosis to do that. Doctors ethically withdraw care at the end of life all the time. These new definitions are solely meant for organ procurement, and that's wrong. That's the tail wagging the dog. So what is our path forward? I think the public needs full transparency. Is that too much to ask? I mean, really, can't we just be honest with people so that they can make a fully informed decision? I understand we live in a pluralistic society, and some will make one decision and some will make another, but I think everyone deserves the right to make a fully informed decision. For this DCD donation, because we know that people have auto-resuscitated, regained a heartbeat after 10 minutes of cardiac arrest, we have to have a waiting period more than that. We can't have this 2 to 5 minute thing they're doing, because that's guaranteeing we'll have more donors like Misty Hawkins having a beating heart when their breastbone is sawed open. And, the other thing is we need an opt-out to the brain death diagnosis nationwide, not just in New Jersey, because what's happening now, I mean, if your loved one is declared brain dead and you don't live in New Jersey, that care will be discontinued. I mean, it absolutely will, no matter how much your family would like it to be otherwise. So why can't people who want to have some continued care for their loved one, why can't they have that? People say, oh, it will cost too much. It'll be all these people taking up ICU space. Well, no, we have a model for this. In New Jersey, this opt-out law has been in place since 1991. New Jersey is in no different shape than any of the other U.S. states. This proves that I think this is a straw man argument. If we allow people an opt-out, some will take it. Most may not, but we should have that availability for people.
I agree. That's a great call to action.
Yes.
And again, I like to point out, I am not, believe it or not, I am not against transplant. Living donation in which both the donor and the recipient remain alive after the procedure is a wonderful, moral, ethical, altruistic way to help someone in need. I have a personal family friend who gave her kidney to her young daughter, and the mother and daughter now are, both alive. The daughter has lived nearly 30 years with that new kidney. So again, there are good ways to do this. And most organs actually can, interestingly enough, be donated in this way. You can give a kidney, you can give a lobe of your liver, you can give a portion of an intestine. You can actually, I was sort of surprised to learn, for lung transplants, they give these people a lobe from each of 2 donors, so that no one ends up, being terribly air hungry, and that can be done ethically as well. Obviously a heart cannot be done that way, but the good news is that a totally implantable artificial heart is currently in clinical trials. And wouldn't that be great to have an artificial heart and you wouldn't have to be on immunosuppression all your life? I mean, there are good new technologies that need to be developed. But again, until those things are on the horizon, I would recommend that nobody be a registered donor. Again, tissues, if you want to donate things that can be donated after biological death, things like skin, bone, heart valves, corneas, just let your family know. You don't need to be a registered donor to do that. Just tell your family, after all their questions about your death have been answered, and after they're sure your death is not the result of a crime, to release your body for that. Because people have run into those problems also. If you're a registered donor, a reporter named Melody Peterson of the LA Times wrote a fascinating article about this. She found many cases in which death investigations had been upended because organ procurement was allowed access to the body before a coroner's autopsy. And there was a terrible situation with a young man named John Flath, who this was way before COVID. He just sat down and died while working out with cadets with the Army ROTC. Because he was a registered organ and tissue donor, his heart valves were taken by organ procurement and sold as medical devices before the coroner was able to evaluate why John had died. But because his heart was so destroyed by the tissue procurement, his family was left with no answers. Another young woman, her name was Christy Rettenman. She was the daughter of, if some of you are Major League Baseball fans, her father was Merv Rettenman, a former Major League Baseball player and coach. Christy came into the hospital with apparent assault and battery and ultimately died of her injuries. But because Christy was a registered donor, organ procurement went and took bone, skin, everything, leaving so little left that the coroner, couldn't look for fractures or bruises and couldn't give enough evidence to allow a homicide case against her boyfriend who had previous arrests for domestic abuse to go forward. And so justice was denied. So again, I tell people, if you want to be a tissue donor, that is biological death, yes, you can do that, but there are caveats to that as well. So don't be a registered donor. Tell your family, and after all their questions as to your cause of death are answered, and they're sure that your death was not a result of a crime, then they could release you to become, say, a cornea donor. That would be fine.
We'll be printing out these today.
Yeah. Yes. I already printed one out.
As we were, see?
Yeah, and if you call or email Halo, they'll send you the pretty laminated ones. I get like 100 of these at a time, and I give them a donation, and I take these to my talks.
Oh, that's wonderful!
You can print off the ones right off the computer. You don't have to have the laminated one.
The laminated one is so much better. I am, and that is Halo. Just because it's upside down, I want people to know it's halovoice.org. So halovoice.org.
Yeah, but if you're registered through the DMV, that won't override it. You have to take your name off of the
DMV and the registry. You have to go to. So on your website, that's respectforhumanlife.com or .org? .com.
I sell books, so it's not a .org, so it's a .com.
So if people go there, they can find how to do that, and also find your book.
Yes,
which is the brain death fallacy. It's a very good book. So they can find that. So it's respectforhumanlife.com. And then is that also where you have your videos, or is that like on YouTube?
So there is a link to the YouTube, but I am on YouTube under @Heidi Klessig MD, and that's our series, Organ Donation Explained. I'm on X if you're an X follower. I mean, I'm at Heidi Klessig MD. I try to post some kind of update almost every day, just on what's coming up in the news.
Maybe one of these Saturdays we could do a X space on this this very issue, and people can come in and ask questions, or we do an X space every Saturday at 3 p.m. Central, 4 p.m. Eastern on various topics, medical freedom topics, and this would be a great one actually to do.
Sure,
and
I love that.
There's so much. X has incredible reach, so might be a great idea to talk through some of this. Some of these things we'll organize. Now that I've thrown it out there, we'll organize it. people will be like, when are you going to have it? So that is the presentation. What an incredible, packed full of information. You leave like no questions unanswered that I had on my list. That is incredible. I do wonder, have there been any do you know if there have been any states that have been able to stop the process of signing up for such an important medical decision at the DMV? I mean, we mock not, I mean, I don't mock DMV workers. Every job's a job. I have mocked you guys, but they, like, it's literally the DMV. You're not going, if they, could you imagine if they had to go through every and truly give informed informed consent before somebody signed that, and each they were held responsible for that? We shouldn't even, that shouldn't even be a place that you make such a critical medical decision.
Right. Right. They have no medical training and no legal training. I mean, it's absolutely wrong for them to be put in that position.
Yeah, at 16, when you're, and when you're going, when you're, like you said, they, it's the propaganda. Do you want the gift of life, the gift that keeps giving? You know, I mean, what a, that they even call it the honor walk, right? When they,
Oh,
the
oh,
person,
don't
like,
get me started. I mean, what an indoctrinating procedure. I mean, that it really bothers me, this honor walk, how they make not only the family but hospital personnel stand there at attention and participate in this heartbreaking spectacle of a living person being taken off to the operating room to be dismembered to death. It's a very indoctrinating sort of thing to make people do,
yeah,
and I think it's wrong. I
I
mean,
too.
terrible,
I,
terrible.
I do too, and it's very bothersome. So, right. Do you,
Yeah.
Heidi Vaughn, do you have any questions? Because you just dealt with this situation, and I,
Well, I would encourage everybody to share this video far and wide, because if I would have had this information, if people within the community had this information, then they could have figured out a way, to get to the parents.
right, because when you need the information now, because it's too late to learn about it as you're going through it, because everything's
Exactly.
emotional, and you're getting, all this conflicting information. It's very it's almost like high pressure sales, right? Like, because the organ donation people get called, and they are kind of like used car salesmen, right? Like, they're like all over the family like that. So
Yeah,
I
doctors and nurses actually are prohibited from having these conversations because we're not very good at it. We're a little conflicted about it in most cases. They have to have either the organ procurement organization team member or someone who has received training that's called a designated requester, because they've been schooled on the body language, the social cues, the techniques that work to get organs, and only those people are allowed to approach the family.
Well, that's like saying they're calling in a closer.
Sort of.
I mean,
Mhm.
wow. In sales, they call it the closer. If you can't close the sale, they bring in the closer.
Mhm.
That that's actually a little bit It's a lot disturbing.
Well, the new investigation that was just initiated by the U.S. House Ways and Means Committee addressed some of these problems in New Jersey. An organ procurement organization in New Jersey actually was misrepresenting to families that the New Jersey Department of Motor Vehicles had their loved one as a registered organ donor, when that in fact was not the case. Also, this New Jersey OPO was telling people who had withdrawn their names from the organ procurement
Mhm.
list that they're still on there. They were actually lying about that and misrepresenting that to families. So again, these people are not showing themselves to be worthy of trust.
Yeah, I know cases of where that happened in Texas too. So Texas, and also Kentucky. So I'm sure it's, if you find it in some states, you'll probably find it in most states.
Mhm.
Incredible,
It's
incredible.
just horrific.
Well, we appreciate all of the time that you've taken to
Yeah.
go through all of this, and the work that you are doing is incredible. And I know that there's other podcasters out there that we talk to every day that are going to want to be connected with you. So I hope you don't mind that I
Oh, oh,
make
very
some
much. Again,
introductions.
it really bothers me that in the academic literature for 50, 60 years, doctors lawyers, philosophers, scholars have been hotly debating these things,
Mm,
but the public has been kept in the dark, and that's
absolutely.
the people who are being asked to give their loved ones to become organ donors are not being told these things, and that needs to change. So these podcasts are wonderful. Thank you so much for
Absolutely.
the venue to get the message out.
And we will get we will promote these. And in the song, when we added the pictures, we tried to put some of the podcasters that are out there just absolutely hammering these issues unafraid, like Dr. Aranda and Patriots with Grit. And we tried to put some of their little pictures in there with you doing the interview, because those podcasters are they're out there trying to create a transparent world. So we really appreciate that. And I'm going to encourage people to share this when we get this out there on our website.
Yes,
um,
Thank you
thank you
so
so
much.
much.
Thank you for the beautiful song.
You're saving so many lives. Thank you.
awesome. And we're going to attach the song to this too, so people have that, because those songs go far. I mean, Heidi's incredible when she puts her songs together. So, and we do have a Rumble channel, everyone. It is under our Betrayal Project USA Rumble channel, and we have a specific channel now for Heidi's music, for Heidi Bond's music. It's called Music for the Movement, and so people can go find all of the songs that she writes there. She's going to be famous someday, and I hope she remembers us. Thanks, everyone, and we'll see you next time.
All right. Bye-bye.